Welcome to Caring for Your Skin. I'm Dr. Paul Friedman, a board-certified dermatologist in Houston and New York. And I wanted to take some time out today to share some general skincare tips, as well as discuss a solution for one of the most common questions that we get in our office. What can I do short of surgery or injections for smoother, younger, vibrant-looking skin? For the past few weeks, we've been asking you to share your skincare concerns, and you've sent over some great questions that we'll be answering throughout this session. I wanted to take some time to introduce you to one of my patients, Megan Wessels, who will be joining me in a few minutes to talk about one of the treatment options in particular that's helped her skin throughout her skincare concerns. It becomes especially important to protect your skin. Skin complexion can be worsened in the summer, so many patients want to improve their skin tone and prevent further sun damage. This is the time of year that I see many patients who are feeling more self-conscious about their skin, especially the last 3 to 4 months where we've all been staring at ourselves on Zoom. It's summer, everyone wants to look and feel good. Of course, this year, unfortunately, we've had another layer of stress to our lives, something we've never really faced before. And stress can play a significant role in triggering many skin conditions. And so I'm telling my patients now that it's especially important to focus on your skincare routine right now and to really take care of yourselves. One question that I'm getting a lot in my office is about virtual consultations and what this looks like. And actually, this has been really well received, and it's something that I plan to continue for the foreseeable future. And it basically allows us to visit virtually in a secure HIPAA-compliant format to discuss patients' concerns and then discuss treatment options and expectations without patients needing to come into the office. And what this allows us to do is it allows us to reduce the foot traffic in the office, and these virtual appointments have been incredibly well received. That's one of the reasons why I thought about hosting this live event. I wanted to create a virtual forum where we could all come together and answer some of your questions and help just start the conversation about your skin. We're getting quite a few patients calling and asking us what their options are. And the main thing that we're hearing consistently is patients want noticeable, natural results with minimal downtime. We are seeing more patients who are willing to accept a few days of downtime because social calendars are opening up with all the social distancing that we're doing. But let's talk a little bit about our options when the goal is to see noticeable results without too lengthy of a recovery process. And let's talk about one of the most popular procedures in our office, which is called the Fraxel dual laser. It's a non-surgical laser treatment option that I've turned to throughout the years to help many patients achieve the desired results for a variety of skin conditions. I'm so excited that one of the patients that I've treated throughout the years was kind enough to join us today to talk about her experience with the procedure, because we all want to hear from the patient's perspective. So let me, at this point, introduce Megan Wessels. Megan is a personal trainer and a personal friend. She's actually a former professional dancer for both the NBA and the NFL, and a super busy mom as well. Megan, thank you so much for taking time to be with us today.
Hi, thank you, Dr. Friedman, for having me. You know, I think this is so cool that you're doing this. I had a lot of questions coming when I first started seeing you for my skin issues. And so I think everyone appreciates you taking the time to answer these questions and sharing your expertise with us all.
Great. Are you comfortable with us talking a little bit about your skin concerns and what the process has meant to you?
Of course. Well, as you know, I experienced quite a bit of adult acne in my 20s, and it was getting worse. And I was dancing and wearing a lot of makeup and sweating and practicing. And it became so painful and really embarrassing. And I ended up with a lot of scars on my cheeks and my face. And coupled with the scarring was sun damage, causing fine lines and wrinkles in my later 20s. And, you know, I just was not as confident and happy with my skin as I should have been. And since I was dancing professionally, I was taking photos with fans and meeting and greeting people. And it was my job to look good and to feel good. And so that's when I came to see you. And my husband took me there to help offer some encouragement. And we talked about the Fraxel and different lasers you could use to help me. So I jumped on board. And now at 40, my skin concerns are not acne scarring, but they're definitely fine lines and wrinkles. And Fraxel is an easy way to get a fresher and smoother look.
So are you comfortable if we look at some of your initial photographs?
Let's do it.
So in preparation for this today, I actually went back and reviewed your records, and we first met in 2008. And I think what I was most struck by was, your story in terms of your interaction with fans, how important your skin was in terms of the various photo shoots you were doing and your performances. And then you were also describing to me the pain that you were going through in terms of the acne and all the various treatment options that you had tried. And it was really, you were clearly really struggling. I think you were about 28 years old when we first met. And my biggest concern for you, people think about acne as more of a teenage issue. And so I think it's interesting that we kind of go through your history because, emphasizing that this is an issue for adult patients as well. There's a hormonal component to acne, and we can go through that as well. But I think what's equally important is talking about the sequelae of acne, which are visible in your photographs here. And you can see these areas of discoloration, the texture irregularity, some of the redness. And, my goal was to manage the acne medically first, which we did using a variety of topical and both oral antibiotics, vitamin A creams, and a good medicated cleanser. And then once we got your acne under control, we talked about utilizing fractionated laser technology to improve the overall appearance of your skin, to help reduce the sequelae of acne, improve your complexion and skin tone, and your overall texture. Which reminds me of a question that we received when preparing for this, was the question that came in was, can Fraxel treat all skin types? And the technology, this particular wavelength, I'm referring to the 1550 wavelength in the Fraxel laser technology, is actually colorblind. And that's one of the reasons why it's been so instrumental in our practice in terms of our ability to treat all patients with various skin types, practicing predominantly in Houston, Texas, which is the most ethnically diverse city in the country. We see a lot of skin of color. And so our ability to treat patients with a variety of conditions in all skin types has really been a game changer. And it's something that has allowed us to help patients with a variety of conditions. Now, Megan, what makes you such a particularly incredible candidate for this technology is your fair skin. And can we talk a little bit about what the recovery what it was like for you in terms of the process itself? I was looking at some of my notes, and I remember you would, going back to 2008, you would like to come in over on a Friday, and that would allow you typically to recover over the weekend. And I think that's very interesting because we actually have a name for that in our practice. We call it Fraxel Fridays. It's definitely a time where people like to do the procedure. What was that recovery like for you?
It was good. Yeah, by Monday I was fine and confident that nothing was showing, the puffiness, the redness was pretty much gone. I did all of the things that your office asked me to do. And I think the recovery within a few days was great.
Right. So, what's also revolutionary about the technology is that it allows us to treat other areas that we wouldn't resurface in the past with traditional laser technology because of the risk of scarring. So it's not uncommon for us to treat areas such as the neck, the chest, the arms, the hands. And, those are areas that I think patients are typically not as religious about applying sunscreen, and it's not uncommon for patients to come in where they have more advanced sun damage off the face. And so this is a nice treatment option for those patients as well. So can we talk a little bit more, Megan, about how you felt going into the procedure and what your experience was?
Yeah, of course. So I was a little nervous. I didn't know what to expect. I mean, it's a laser. I have never had surgery in the past, so I definitely had some concerns on how uncomfortable I was going to feel. But your staff very well prepared me for what to expect during and afterwards.
Wonderful. I remember you telling me that you like to do yoga, and I found that type of breathing really helps with these various procedures. Did you utilize some of that breathing during the procedure?
Of course. I'm all about deep breaths. Natural childbirth over here, laser, all over it.
And then I think you sent me another patient subsequently who had some concerns with some sun damage on her neck. Is that right?
Yeah, yes. I had my former coworker, Margot. She was very uncomfortable with her neck, and she was always wearing scarves and things to hide her neck. And she saw that I was getting treatment for my scarring. And so she was able to see you, and I was able to see that transformation go down. And she was in her 60s. And at that time, I was late 20s. And I think that's what's so cool about this laser is that it's timeless. You can treat the young, you can treat seniors, and get great results.
Absolutely, and I think that's something that shines through in looking at you today. Is just we started your treatment back in 2008. You had 3 treatments, and I mean your skin still looks fabulous today. So I think ultimately our ability to basically slow the aging process is something that patients are coming to me now earlier to try to put off the need for something more invasive laser, and that's where this technology really fits nicely. Not only with me, but with my colleagues around the world. And again, the ability to also help with other signs of sun damage, including age spots and fine lines and wrinkles, in addition to acne and surgical scarring, has made it really versatile. I'd love to go through your video treatment if you're comfortable with that, Megan, and we can talk a little bit about what this looks like when you're actually going through the treatment.
Yeah, I've never seen it. Let's do it.
All right. So here we go. There's you are. You can see we're starting with utilizing the technology with the cold air to help protect and offset the heat of the laser. Obviously, we're taking measures to protect your eyes, and everything's happening at a microscopic level. It's basically the way I describe this to patients is if you think about your skin as like a digital photograph, this is like Adobe Photoshop for the skin, where we're basically retouching the skin in a dot-like or pixelated pattern, allowing the untreated areas around the treated areas to help with the healing process. So just a more intelligent way of delivering energy. And as throughout the treatment, you can see you're starting to get some minimal redness, and we're offsetting some of the discomfort with the cold air, and of course the topical numbing cream is applied before the procedure. And the ultimate goal is to stimulate new collagen, softening out the acne scars, reducing fine lines, and leaving the surrounding skin intact, promoting rapid healing. So what are you feeling at this point, Megan?
Honestly, I felt heat and cold at the same time. It was pretty easy, and I'm really thankful for the numbing cream. It doesn't feel like much. Like I said, hot and cold. I think it took about 20, 25 minutes, and we were done. Very simple procedure for me.
So what does the sensation feel like?
It's hot on your skin, and I wouldn't say burning, but it's a steady heat. And like I said, with the cold air blowing at the same time, afterwards your face does feel hot, kind of like a sunburn. And there was some puffiness and redness for a couple days. Like I said, but then that went away, and I was ready to go Monday.
Right. Yeah, so the cold air is integrated. So in that particular video, we're showing a separate cooling system, but the air is actually integrated into the device as well. And I commonly get a lot of questions about this feature. And that's something that makes a really big difference in terms of comfort for the patients. So let's take a few more questions about laser resurfacing. Some questions are coming in. Where does it treat? Can it treat acne scars or sunspots on my body in addition to my face? So again, as we touched on earlier, one advantage of the fractionated mode of delivery is it's a more gentler way of resurfacing the skin. So it does allow us to treat concerns off the face. It's not uncommon for us to actually treat multiple areas on the same day, including the face, the neck, the chest. Sometimes patients will come in and we'll treat their arms and their hands. And so that is something that we'll commonly do because it's interesting because I'll often have patients where the areas that we've treated look fantastic, and then I'll look at their hands and I'll be like, well, why don't we consider addressing your hands as well, because there's other areas that'll start showing more signs of advanced aging. And so it ultimately becomes areas that we tend to address as the patients proceed during their treatment process. So that's a great question. Another question coming in, what does the downtime look like? What type of results can I expect? I think those are great questions. We touched a little bit about those earlier. Downtime, that's something that we're going to have a conversation together. And I think that's what's so another advantage of this technology is there's a broad range of treatment parameters that I can deliver based on the patient's social calendar, their condition, what type of results do they want to see, how quickly. So it's really a discussion that we have together. Do you want to maximize, get the best bang for your buck and have a little bit more of an extended recovery? Or are you looking for something where you can really resume fairly quickly into your social calendar and you're okay coming in for perhaps a subsequent treatment or two on the back end? That plays a role. Sometimes, obviously, the age of the patient plays a role. For patients that are coming in at younger ages, obviously, we're not going to have to utilize the settings for somebody who's more mature. And so there's a lot of variables at play that we can tailor based on the patient's conditions and basically requested downtime. There are a few tricks that we have incorporated throughout the years as well for patients who absolutely perhaps want a more aggressive type of procedure but don't want the downtime. It's not uncommon for us to prescribe a short course of an oral steroid to take for about 3 days, which will help with the recovery process as well. So again, it's something that can be individualized based on your concerns and desires. Let's see, we have some other questions coming in. Can this be used with other treatments? Another wonderful question, and I think something that we should have touched on earlier, because in Megan's case, we actually, it was something that we talked about in terms of using combination of modalities to achieve the desired outcome. And because of the gentler way that we're delivering this laser energy, it's not uncommon for us to use combination of energy-based devices on the same day. So perhaps we can use something that's a little bit more targeted for specifically just for red, or something that's a little bit more targeted specifically for pigment, where patients can accelerate the overall improvement as compared to using one modality alone. And that's where I think experience really comes in, and going to a provider who understands how these energy-based devices can be combined in both a safe and effective manner to basically maximize the outcome and the potential for the patients who don't necessarily want to come in for multiple treatment sessions. A question just came in. Who would you recommend Fraxel for? Again, I think this is a technology that can be a benefit in patients of various ages. It's not uncommon for us to treat teenagers with acne scarring, patients such as Megan, who perhaps are in their 20s, suffering with perhaps some acne scarring or some early signs of sun damage, to patients in their 50s and 60s who have more advanced signs of sun damage and want to utilize the more aggressive parameters that we can deliver to help reverse some of those signs of damage, or somebody in between who just wants to slow the aging process and do whatever they can to put off the need for more aggressive procedures later in life. One more question that just came in that we hear a lot is Fraxel safe to be performed year-round, including the summer? A question that we get very commonly here in Houston with a very tropical climate year-round, and it is a procedure that we do year-round, but it's something where the patients have to prove to me that they're going to do their job in terms of protecting their skin from the sun. If a patient comes in with tan skin, then we typically will ask them to reschedule their appointment, usually for about 3 to 4 weeks until that tan is fade. So as long as you're doing your part and protecting your skin from the sun both before and after the procedure, then this is a procedure we can do year-round. And finally, I want to address any lingering questions about how safe is it to visit a dermatologist right now in these difficult times. Our offices are open with precautions. I've been involved with a lot of the national societies with other colleagues around the globe, talking about best safety practices to ensure the safety of both our staff as well as our patients. And so there is an art. There are some things that are going to look differently when you come into the office. For one thing, you won't see my face. I'm going to have a mask on. I'm going to have a face shield on. You're going to have a mask on. We don't remove the mask until the actual procedure. We're doing things to sanitize the rooms. Between patients, you're going to see lower number of patients who are actually in the clinic at one time. There's precautions that we're taking to help ventilate the air. And so it's something that we're taking very seriously because ultimately, your safety is first. And so things are going to look very differently when you come in if you desire this procedure. You can also look for a dermatologist near you who is offering this procedure by going to Fraxel.com. And certainly we're available to see patients if you're in our area, and you can schedule an appointment by going to dermlasersurgery.com. And on our Instagram handle, I've posted a video that talks a little bit about virtual consultations and how those are working in terms of basically having the ability to do a visit and talk about all these things before you come into the office. So cutting down on the number of visits that are required with our ability to leverage this amazing technology to visit virtually, to discuss all these questions that you may have about your particular skin concern prior to your visit to our office. In addition to offering virtual appointments and consultations, offices in Houston and New York are taking extra precautions to ensure the safety of all of our patients. And we talked about the safety protocols, and you can see those again on our website or on my Instagram at Dr. Paul M. Friedman. And certainly if you want to learn more about Megan's story, she was featured in my book, Beautiful Skin Revealed. And we just go more into how to utilize modern technology and expert techniques to take away some of the frustration and uncertainty out of skincare. And that was the whole point of this discussion, is to talk a little bit to kind of demystify the process. And hopefully we were able to personalize it, and you found this very useful. And I really want to just now take time to thank Megan so much for taking time out of your busy schedule to join us today, to share your story. I mean, I think it's a testament to you that you're willing to, not only in the book, but now on this other platform, to talk about and share your experiences. It really talks to who you are as a person, that you're willing to share your experiences to help others.
Yes, thank you. And I thank you for having me and sharing my story so I can help others and giving me that platform.
Well, if it allows me to see you, it's always great, Megan, and hopefully we can do this again. And please, everyone, provide your feedback and let us know, what you enjoyed about today's experience, what we can do in the future. And please be safe. And I hope everyone enjoyed this as much as Megan and I did. Thank you again.